This is Dr. Leo Urbanelli with PNW Plastic Surgery. I wanted to give you guys a quick insider scoop on the most commonly asked question in my office. Patients ask me every day in my office, what would you do or what should I do if you were in my shoes? That's a very difficult question to ask your plastic surgeon. For starters, don't do plastic surgery because I told you to do plastic surgery or that your plastic surgeon thinks you should do it. Do plastic surgery for you. Do plastic surgery to address an area that bothers you. And those are the patients that tend to be happiest if they have a specific complaint or specific problem area that they want addressed. If patients are considering different options or different areas, I usually give them options from non-surgical to minimally invasive to surgical options. I typically tell patients that I can't put myself in your shoes because we live different lives. I have my kids I have to take care of, or I have patients that I am honored and privileged to take care of. So I can't take 2 weeks off to recover from X procedure. Or if I have a social gathering coming, I don't want to look bruised or swollen, so I may choose a non-invasive procedure for myself. But that doesn't mean that if you work from home and can work on a computer, you couldn't recover in the quiet of your own home with a couple bruises from a blepharoplasty or a facelift. I mentioned those things because we're all different. We all have a different home life or lifestyle that we have to be conscious of. We all have different budgets. Money doesn't grow on trees. In my practice, everybody gets options. The options are so that way you can pick the right procedure that fits your budget, your downtime, your expectations. Additionally, the risks that you're willing to undergo. Some patients really are scared of anesthesia, don't want to undergo general anesthesia, or are not good candidates for general anesthesia. And so those patients, I talk to them about non-surgical, and that's probably what I would err towards if I had a cardiac valve that I couldn't be off of my Coumadin. So those are things that I can't necessarily step into your shoes, but it's the most commonly asked question in my practice is, Dr. Urbanelli, what would you do if you were me? I can't answer that, but I can answer for myself, and you should answer for yourself too.